Good afternoon. Welcome to this Blackhawk County Emergency Management COVID-19 EOC press briefing for today, April 30th. And today's press briefing will help cover information with regard to the spread of the coronavirus here in Blackhawk County. We will be talking a little bit about our business defenses, and we have with us Cary Darrah from Grow, Cedar Valley. We also have with us from Care Initiatives, which manages, I believe, 3 long-term care facilities here in Blackhawk County, nursing homes, Jason Bridie. And so we're going to focus kind of on where things sit today with regard to how the fight against the COVID-19 virus has matured here in Blackhawk County. This is our first fully virtual press conference, so I want to go over a couple of the parameters on how this is going to work. Obviously, for those of you participating via Zoom, there is an opportunity to raise your hand. *9 will allow you to do that, or on the application itself, there is a button to allow for that. You can also chat your questions, and we have facilitators and moderators here in the room that will allow you to interface. We will go ahead and prepare or read through the prepared remarks and allow for the completion of that, and then we will open up to questions. And our 2 participants that are not Nafissa and I are participating via Zoom today and socially distancing themselves as well. So you'll have the opportunity to interact that way as well. So without further ado, I will introduce you to our incident commander and the director of public health here in Blackhawk County, Dr. Nafissa Cisse-Egbuonye.
Thank you, Sheriff Thompson, and good afternoon, everyone. As of today, 12:30, our current number in Blackhawk County is 1,381 confirmed and reported cases. We have 13 deaths, 49 hospitalized, and 438 recovered. And these numbers are for Blackhawk County. We've had a lot of questions that these numbers might be from people out of county working in Blackhawk. That is not the case. These numbers are, the numbers for testing are reported based on county of residence. So all the numbers here that I have shared with you all are for Blackhawk County residents. As it is important for me to share with you all the numbers, it is also equally important that I remind everybody these numbers that I share with you all are people who are loved and people who are loved. They have names, they have families and stories. So it is our responsibility as a community to continue to do our very best to protect the health of our residents. We continue to ask everybody to stay at home, continue to wear masks, wash your hands, and stay at home when sick. Today we're talking to the businesses, and I'm very happy that Ms. Cary Darrah of Grow Cedar Valley is here with us today. To our business colleagues who are listening, we are here for you all. The truth of the matter is public health, the healthcare system, and businesses share an interest, and that is ensuring the health of our community. A healthy community is correlated with a healthy economy. Businesses need to have a financial interest in supporting public health efforts to reduce the spread of COVID-19. Businesses creating a healthy and safe work environment for your employees can have a large return on your investment. I applaud all the businesses who have implemented the necessary measures to ensure the health of their employees. I applaud efforts that organizations such as Costco have made requiring their customers to wear face masks. Thank you very much. I also want to touch base on something important. I am fully aware that we've made national news. I wish that we made national news for something to be proud of. However, unfortunately, that is not the case. So for me, the most important message in all of this is that as a community, it is our time to show the nation we stay united and not divided. We will continue to stay home. We will continue to wear our face masks. We'll continue to practice social distancing because we are a resilient community, and I know we will get through this. Thank you very much.
Before I introduce our first speakers, I do have a couple of brief comments. Our fight today has changed, and it's changed dramatically simply because the initial line of defense has changed. It has migrated because we've had to fall back. We lost our first line of defense out there in the community. We had a huge hole blown in that first line of defense. And that's frustrating because it put at greater risk all of our citizens here in Black Hawk County. Today's front line lies on the front lawns and the front doors of our long-term care facilities, which is why we have Jason Bridie with us here from Care Initiatives. It lies in the hallways of our emergency rooms. It lies within the hallways of my correctional facility as we start having our staff test positive. These are the places we did not want to fight the COVID-19 virus. These are the places where our most vulnerable populations sit. These are the places where our most serious and our seriously concerned citizens populate. And that frustrates because today, had we not had to fight on these front lawns, we would still be sitting there not as the single highest county in Black Hawk County, where our citizens now are at the greatest risk of contracting the COVID-19 virus. That's not fair. That's not the way this should be whatsoever, and we should not be making national news for these kinds of situations. But I concur and I absolutely agree that this is our time to shine and demonstrate what true governance, true leadership, and true opportunity looks like. I know that we've been asking you to stay at home, to stay safe, to wear masks, to not go out unless you need something essential. We've asked for all of those things all along. We've been preaching that for 2 months now. And I know that gets tiring and it gets wearing, but we've promised every day at 1 o'clock I hold a planning meeting for the Emergency Operations Center. We have 40 to 50 partners, whether that's legislators or community organizations or key leaders within our county. And I promise them that we will continue to propagate that same message every time we have the chance to stand in front of you. Because it's just as important now, if not more important now, than it was the first time Dr. Nafissa said it. And I know it's beautiful. I know the weather's getting nice. But now more than ever, especially as the surge continues to spike, it becomes that much more critical that you adhere to and heed those warnings, even as other counties in the state start to loosen restrictions, even as churches start to contemplate what that might look like to enjoy congregations and Sunday services again. We continue to encourage distancing, staying at home, protecting yourselves, protecting your families. Now more than ever, this is where we have to buckle down. We have to share responsibility for protecting yourselves and protecting your neighbors. Now it is my great pleasure to introduce to you the President and CEO of Grow Cedar Valley, Ms. Cary Darrah. Cary,
and the ability for this community to shine nationally. So we have that capability and we have that desire, and I know that it's going to happen. So thank you for inviting us to share in this very important message. Grow Cedar Valley has been providing access to resources to help our local businesses and organizations navigate through this crisis. And we're a long way from the finish line, has already been explained, but we've also been preparing for what recovery looks like and preparing to help our businesses open their doors when it's safe. It's never too early to put together a plan. We believe it's important to be smart, safe, and patient with next steps. There are many Cedar Valley employers who are taking these safety guidelines seriously, and we applaud those efforts. And we know there are some who are looking for guidance. There are many resources to help you plan and prepare. GrowCedarValley.com has a COVID-19 resource page with guidelines under the section COVID-19 Information for Employers, including return to work action plans and HR plans. Please take a look at these resources to begin planning and for your preparation. The Governor's Proclamation for the phased opening of businesses identifies some of those requirements for those businesses that are included in her message. Your business or organization may and probably will look different than it did 2 months ago. From an employer, employee, and customer perspective, it will look different. There are guidelines to all phases of reopening. Some specific areas for early considerations include return to work in phases, encourage remote or telework where possible, continue to work remotely where possible, modifications to physical access to work environment, common area space reconfiguration, flexible workspace, possible temperature screenings, restroom social distancing, sanitary kits for employees, signage for social distancing, and sanitation of workplace. Those are only a few, but very important ones. Moving forward, it's critical to be smart, safe, and take a step-by-step approach as we reopen the economy. Smart as we look ahead to the next several weeks, we all need to continue to do the smart things to keep us all healthy and protected, both personally and as a business. Safety is key. Businesses will have to rethink many of their practices to keep their workforce and their customers safe. Step by step, it will take patience. Each day, each week will bring challenges, but we will get through this together, slowly implementing the change. Grow Cedar Valley's commitment is to eventually get back to the things that what we were doing to make this local economy strong. Business growth, infrastructure, entrepreneurial efforts, workforce training, etc. Our community was doing a lot of the right things to grow and prosper. We can't lose the progress that was made. With the help from our business community, we can grow and prosper again when it's safe and likely different than before. Most importantly, now is not the time to let up on the gas. Please continue to practice the safety measures outlined by the CDC and Blackhawk County Health Department of social distancing and providing protective equipment and using it while you plan and prepare to open your doors. Thank you again for having us. We know this is important. We're here every step of the way to make sure that we do this safely. Thank you.
Our final presenter today will be the Director of Marketing for Care Initiatives, a long-term care facility management team, Mr. Jason Bridie.
Thank you. Again, my name is Jason Bridie, and I represent Care Initiatives, a not-for-profit Iowa-based healthcare organization. We own and operate a total of 5 Blackhawk County-based healthcare entities. Those are LaPorte City Specialty Care, North Crest Specialty Care, Pinnacle Specialty Care, Ravenwood Specialty Care, and we also operate a Care Initiatives hospice service, which is an independently run organization that not only works in Blackhawk County, but the surrounding area. I'd echo many of the things that the director, the sheriff, Ms. Darrah spoke about in terms of keeping the foot on the gas, and that certainly we're not out of the woods yet. Some of the things I'm also going to mention will really be a little bit of a reiteration of what we've spoken to before, but they are so very important, and they are things that we are doing and what we asked the community and the public to do to help us mitigate the spread of the coronavirus. So when we last spoke in this venue 3 weeks ago, and the last time I was before the camera here, we were fortunate to report 0 COVID-19 residents or staff members at any of our 4 long-term care locations or within our hospice service. We feel fortunate to be able to report 3 weeks later that of the 375 residents and patients that we care for, and over 400 employees that work for us at all of our locations, we have 0 residents or patients testing positive as of this point in time. And we have 2 staff members who have tested positive in one of 5 locations in Blackhawk County. And we did publicize that a few days ago when that first occurred. We would like to think that our infection control efforts in the past 7 weeks to mitigate the exposure has really helped us to this point. So we do feel somewhat positive about the direction we've been headed in, but we want to keep that positive momentum going. We continue to look after the health and safety of our residents and our employees. We continue to implement a no visitor policy. We screen our employees before and after each shift for signs and symptoms of COVID-19 and ask about their recent travel or if they've been in contact with someone with COVID-19. So our staff have been wearing PPE for weeks, which is the personal protective equipment. We are screening our residents twice a day by reviewing and recording their vitals and their temperatures. This is a practice that most healthcare organizations are doing as well. We really believe that these precautions are helping, but we're not declaring victory just yet. As we've seen here in Black Hawk County, the COVID-19 outbreak has hit this community hard in recent days. We are told we are weeks from reaching the peak in this area. Because this invisible virus is still gripping our county and our state, we continue to remind our employees to stay home as much as possible in an effort to limit any outside exposure. We in turn want to ask the general public to continue to do the same for the sake of our residents and of our healthcare staff who take care of these residents 24 hours a day, 7 days a week. Please limit your time in public places, social distance if you are near a group of people, and wear a face mask if you're able. If you have a loved one in a nursing home, please reach out to the facility to make arrangements for a telephone visit or a video visit. Window visits and window decorating, such as adding a drawing, a bird feeder, or a windsock are great too. Our locations offer games and activities to help our residents stay engaged. Our Care Initiatives hospice team has helped provide nursing home residents around the area with activity booklets, and they've helped fill bird feeders, among other things that they're doing to do their part, as well as taking care of their own patients who are at end of life. And our hospice counselors are also offering their services to all nursing home employees throughout the area to be a resource for people to call, completely confidential, and we'll be releasing more information about that soon. If you are so inclined and listening in, our residents love messages. They love cards and letters, as well as the artwork masterpieces that those kids come up with. So please feel free to send any correspondence to any of our locations to help put a smile on the faces of our staff and of our residents. We look forward to the days of being able to have family members able to visit loved ones again. And until then, please be safe. So with that, I will turn it back over to the sheriff.
Thank you, Jason. That all right, Gabby? Mm-hmm. All right. So those conclude our prepared remarks, pending your questions. Yes, ma'am.
I was wondering if you've spoken to the governor regarding her meeting with Vice President Pence on the meatpacking order that came down from Trump and what it means for Tyson.
I have not. We have had multiple conversations with regard to that. We have heard from several different sources. We have heard from people within the U.S. Department of Agriculture that they are anticipating, and I think they specifically mentioned the Waterloo plant, the Worthington plant, and the Sioux Falls plant, I believe, that they're anticipating a 3-day stand-up, but I have not heard that directly from anyone within the administration, either the state administration or the federal administration.
What does the 3-day stand-up mean?
Meaning that I think that they're in the preparation of trying to comply with the president's DPA request.
Within 3 days, they would try to be open?
That's my understanding. I don't know that for a fact, but that's what I've been hearing that's been said.
We have a question from Iowa Public Radio for Dr. Egbuonye. What are your takeaways from the Test Iowa site in Waterloo? Is it meeting residents' needs, and are there any barriers to access?
So as of this moment, we haven't heard any barriers. I think 2 things to keep in mind is that most of the individuals that perhaps have language barriers, they go to their specific providers. So I don't believe they're using the online assessment. And so those that have been using, we haven't heard any negative feedback.
How many people have been tested through that site so far?
We don't have a number for that yet. And then I just want to clarify something, Amy, in reference to your question. I did talk to Tyson Corporate just to clarify whether we've heard rumors about them opening perhaps on Monday, and they did indicate that wasn't communicated. So they don't have a specific date in terms of when they will open, per Tyson.
And there's a question from KWWL. With President Trump's executive order regarding the continuous operation of meatpacking plants and reopening of the plants, how is the county preparing for once Tyson resumes operations in Waterloo?
Oh, well, in terms of the health department, we're always preparing. I mean, we've been preparing before the first confirmed case on March 18th. So our goal is to always ensure that we have enough test kits to be able to test the individuals that are in need. And secondly, I've been in communication with the state in terms of just always having those resources, and the state did indicate that as long as there's supply, they'll make sure that we have that. So we're I think Tyson they did the testing for over the weekend, Friday and Saturday, but they did also communicate with us that they are going to try and implement random testing within their plans. So any Tyson questions for more specific details, I'd ask that the media reaches to Tyson directly.
Okay, and then from Iowa Public Radio, do you have concerns about the validity of the Test Iowa tests? Reporters in Utah have raised such concerns about testing there, which is run by the same company.
I don't have concerns yet. Those are not concerns that have been presented to us at the moment. I do know the tests are being run by the State Hygienic Lab. This is the same process we've been using with our healthcare systems, and so we haven't heard any complaints through that process.
How many cases are we still at about 90% of the cases can be attributed to Tyson, or has that number changed?
We can say that 90% of the case have been attributed or related. I think that's the things to keep in mind. It's just, so it might not be a direct Tyson case contact, but it might be somebody, a second exposure or something like that. Mm-hmm.
Does the Blackhawk County Health Department have plans to request a visit to Tyson before they open, just to make sure, just to see what they've done and what they've accomplished before they are reopening? Yes,
most definitely. And keep in mind, we have been in constant communication with Tyson, the local management, and the corporate office. As I have communicated earlier, businesses matter to us. Businesses is what helps thrives our economy. So this is not, it's just, this is a partnership. We value those partnerships, those relationships. And so they've always been open, readily available to communicate with me. And I will continue to have those conversations with them.
And KCRG, with Blackhawk County having a high number of cases and now the anticipated reopening of Tyson, has state or federal government reached out with any sort of guidance or plans to assist with the process to mitigate the risk to employees and the public?
Again, as I have stated, Tyson Corporate has communicated with me that they don't have a specific date for the reopening of the Waterloo plant.
With the governor's announcement that the state is, some counties are going to reopen their businesses limited starting tomorrow. I guess, is there any recommendation that you would give for, since Blackhawk County is not in that and she's recommending no travel outside of our counties, how tempting would it be for people to travel to another county that their businesses are open? And what did you say to people that would think about doing something like that?
It's tempting for people to go out and socially gather. It's a beautiful day. I mean, we've been indoors all winter. But right now, the most important thing is for people to understand, again, those numbers are people. right? And so we all have to play our part, and we all have to do our best to stay at home and implement those preventative measures. And so the urge that people get, I just ask for people to just remember those numbers are representation of people, and people that have died, people that have been sick, and families have been worried about. And so just for people to always remember we all have a role to play in controlling the spread of the virus.
And then KCRG just followed up on their question. So beyond, I lost the follow-up, but beyond Tyson, have the state or federal government given any sort of guidance on reopening? Like, have you heard from?
No, I have not. Mm-hmm.
And KWL has a question for Cary, Darrah. I don't know if you can read that, Cary. How is Grow Cedar Valley helping businesses that may be on the edge of closing for good due to the pandemic? And we'll unmute you so you can answer.
I'm happy to share that we have, not happy to share because it's going through a crisis, but to give you the information that you've asked for. We have from the beginning been assessing what resources are available to our businesses and trying to make the connections with the appropriate resource to the business need. I don't know that there's any guarantee that all businesses will come back the way they were 2 months ago. Our hope is that they come back stronger and that we've been able to help with some gap assistance to get them through this crisis. We are working with our businesses on a minute-by-minute, hourly, daily basis. So again, there are no guarantees, but we are open and we are helping any business that comes to us. It doesn't matter whether they're investors of Grow Cedar Valley. Every business in the Cedar Valley is getting our attention when reaching out to us.
Great, thank you. And then we have one last question. Do you have measures that you want the county to reach before businesses would resume in Black Hawk County? And that would be either for Dr. Nafissa or Tony. So testing measures. Yeah.
Okay. Do we have a measure to use for businesses to open?
Measures that you would like the county to reach before businesses would resume. I'm assuming like with positive tests and.
Mm-hmm, mm-hmm. So I think one of the things that's more very important, one, we're still peaking. The second thing is that we do need to start declining first. For us to even assess, right now our hospitals they have a high census, and so I think seeing also the hospitals reach a stable capacity, I think that's very important. And so right now, when you look at some of our cases starting since April 9th, we've been on the rise, and so we need to start seeing a steady decline, and we haven't been seeing that steady decline yet. So there's not a specific number where we just want to start declining first.
Can you talk about the PPE right now as far as the hospitals and the long-term care facilities, how much they have?
Yeah, the hospitals have indicated that they are still good, and I believe long-term care facilities as well, and so. So far right now, it's still good news for us here in Black Hawk County.
All right, folks, as we close this first virtual press briefing, press conference, we'd like to encourage you. We'd like to thank you for your attendance and your attention because this is the way we get our message out. This is the way that we share in solidarity and in the importance of the information that we continue to propagate out to the community. We appreciate our media partners, and we certainly appreciate you paying attention to what we have to tell you. We're in this fight together, and as those numbers continue to climb, and as we hope we are starting to near and reach the peak of what we're seeing, it is our hope and our prayers that we continue to all be in this together. So continue to fight the good fight with us. I'm sorry, Gabby, you had another question?
Yes, for Jason.
Of course.
The question, and so we'll unmute Jason. Okay. So Jason, I don't know if you can see the question, but it says other long-term care facilities in other states are requesting states to grant them legal immunity. Is that something you or other facilities are seeking in Iowa?
I think I would refer you to the Iowa Healthcare Association that maybe has a better take on that. Right now, our facilities and what we've been focusing on is just the day in and day out activity within each building to safely care for and look over our residents and our staff members. I think those are issues that maybe other policymakers and people might be talking about out there, but I don't know that we are right now engaged in that, at least in terms of having a position on it. Our focus has really been clinically based at this point.
Okay, thank you.
All right, so now that Gabby has ruined my cheerleading speech, I will close by telling you we appreciate each and every thought, each and every prayer, and each and every hope for positive resolution as we continue to fight the good fight against this silent virus, this vaporous and difficult adversary. So continue to fight with us, fight alongside of us, and help us as we continue to forge ahead. These next few days, these next couple of weeks are going to be difficult for us. So we champion you, and we hope that you continue to champion us. Help us share that message and share the information with everyone. Keep the fight moving forward. Keep the faith moving forward. And thank you for your time. Thank you very much, folks.